I actually tell every revision patient to consider having their implants out, not just the patients who come in specifically asking for them to be out. This can be a very difficult thing for a lot of patients. They've spent a lot of money, they had a lot of expectations, but sometimes if a patient has had a lot of operations, the wisest thing to do, being that this is a totally medically unnecessary procedure, is just to have the implants removed and be done with it. Sometimes the patient just lets their breast lay fallow for a while, let everything scar down, heal in, relax, and then you start afresh from scratch to see what can be done. But I often hear stories about patients that had breast augmentation at some point in their life because they were younger and they wanted a different kind of look. They had a boyfriend or a husband that encouraged them to do that and they did it against their wishes or their better judgment. The question that everyone asks me is, what will my breasts look like after I remove the implant? In almost every case, they look better than you think they're going to look. In the extreme cases, where there's almost no breast tissue left and you just have this thin peel of skin over a big implant, those can be really difficult situations and you can need to have a lift. But in most situations with a reasonable size implant, the implant can be removed and things can look pretty good. Elsewhere on my website should be photographs of people who've had their implants removed. And you can look at those. The problem is everybody is different, and there's no way to predict from someone else's photos what would happen with you. But with a visit with a good plastic surgeon, you should be able to get some assessment of what you would look like with your implants removed. I would say the biggest issue is how big they are and how long they've been in. You know, it's not that different than breastfeeding. If you have breast implants way bigger than you would ever get breastfeeding, and you've had them in for many years, well, don't think that the effect of the implants can be any less than if you had breastfed all of those years. If, on the other hand, you have an implant of a reasonable size, maybe it's been in less time than that, then you may have a much better chance of looking good. Again, I won't be able to tell you, but if you find a good board-certified plastic surgeon, he or she should help you to find out, or at least give you a good idea of what you might look like after your implant's removed.